everyone. I know most of you, I'm Amelia Berry, and like most of you, I wear a number of different hats in the community, but tonight I'm thrilled to be here with my Franklin County Health Department hat on, along with our Public Health Director, Judy Mattingly. As director of the Just Say Yes project, my work does, as Laura says, focus on preventing substance use among youth. As commissioners, you all know better than just about anyone the energy and resources that our community spends dealing with issues related to addiction. And the research is clear that the longer a child goes without using alcohol, tobacco, and other drugs, the less likely they are to experience problems with addiction later in life. This is really a case where an ounce of prevention is worth many pounds of cure. And we've seen plenty of prevention programs crop up over the years. Some of you may have gotten to experience the DARE program firsthand, as I did, but the results from these programs have been underwhelming at best. What we've learned is that the Just Say No approach, that is one that focuses on steering a kid's individual choices and behaviors, doesn't really work at the population level. Public health population level just means outcomes experienced by a group of people or a population as opposed to the individual. And the gold standard for reducing substance use in youth populations is a model out of Iceland that's produced stunning results there and in several other communities around the world. We've taken their learnings, we've applied what we know about our community, and we've created the Just Say Yes project. Just Say Yes rests on three pillars that are essential to successful prevention work. First, the work has to be ecologically focused. That is, it works to optimize the environments that kids are immersed in as they grow up. Specifically, we focus on family, peer group, school, and out-of-school time, and we work to reduce risk factors and increase protective factors in these areas. So how do we know what to focus on? We use data. We partner with schools to collect robust data to determine what the strongest drivers of substance use are here, now. We generate insights from that data that regular people can understand, and we share the information out quickly with parents, schools, coaches, churches, businesses, policymakers like yourselves, and most importantly, we use the data to guide our actions. The reason there's such a focus on sharing the data is that this work will only be successful if it's highly collaborative. I think you just heard a version of that from a couple of your public comments at the start of this meeting. The kind of ecological shifts that we're after cannot be brought about by one or even a few organizations. It has to be a whole community effort. Requires involvement from the groups I just mentioned, as well as youth themselves, and critically, the involvement of parents. So before I wrap up, I want to give you an example of what this looks like in practice. I want to highlight the Yes card, which really zeroes in on that out-of-school time environment. This is an electronic debit card. It runs on Yifty, the same platform as the Shop Local card, and families use it to pay for activities for their kids. I'm sure you all, even this evening, we heard earfuls as commissioners about the need for more fun and healthy activities for kids to do in Frankfort. And indeed, our youth survey data does show that this low rates of participation in these kinds of activities is an important risk factor for substance use here. The Yes card makes it easier for kids to access activities, not just by subsidizing their participation, but also by engaging their parents with focused messaging that helps them learn and act on this important protective factor for their kids. The Yes cards are funded by the CDC as a pilot project for about 300 middle schoolers over a period of 4 years. And as a quick 1 minute, okay. Quick aside, because Judy Mattingly is here tonight, this would not have happened without her. Before the pandemic monopolized her time, she has just been such a bold supporter of this kind of upstream prevention work as central to the public health of Franklin County. So I want to thank her publicly for that. As you can imagine, launching this during the pandemic has been very challenging, but we've seen some very honestly surprising even to us early positive results. At the pilot school, participation in arts and sports were 3 times higher. The increase over 2020 to 2021 increase was 3 times bigger at the pilot school than in the schools countywide. So this is really promising early data. So looking forward to keeping you in the loop as the program develops.